Okay, we'll shift topics a little bit. Before we do, let's do the obligatory. We are not anti-vax. Consult your doctor. Get the vaccine if you choose to. Do what you got to do. Take care of you and your family. Um, if you are in Canada, particularly Ontario, it sounds as though they are moving forward with requiring you to have a vaccine certificate in order to host a wedding reception. I'm not quite sure that it's clear what the rules will be. It's all in development. But this is Dr. Kieran Moore, Ontario's Chief Medical Officer for Health, revealed starting October 13th. So it's already in effect. So I guess I probably could track that down. Anyone attending a reception will need to show proof of vaccination or medical exemption. And they go on, we've noticed a number of outbreaks associated with weddings, in particular wedding receptions. While the current regulation states individuals who are not fully vaccinated attending a wedding reception in a meeting or event space can provide proof of a negative COVID test in order to attend. This exemption expires on Tuesday. So there is a move to crack down on weddings. And I think what's interesting, Bob, I really wanted your take a little bit on what you think here is at some point now we've got sort of a higher level government pressure point. We've talked about businesses and all that. So let's just presume you have X percent of population that's still not participating, whatever that looks like, however you define it. Now is the time we'll start to see the signs of how will they try to manipulate and move people in other areas of life to force them to participate. Is that a pretty fair assessment of what this may or may not be like?
I suspect so. I mean, I think the mandates are going to be effective to a certain point, but you're still going to have a lot of people that are going to still. I mean, we saw that doctor in UCLA who was escorted out. He was an anesthesiologist. I mean, I would say that's a pretty critical individual who worked all through the outbreak pre-vaccine, and because he didn't want to get it, they escorted him out, and he's gone. He's fired. Well-known anesthesiologist. So yeah, I think I think they're going to have to do this incrementally. They're going to do step by step by step by step until they're going to force people to either, will I be able to feed my family, or am I going to stand up for this principle? You know, I'm not for mandates. I do think it's a little bit on the foolish side not to get vaccinated. There's not a lot of good reasons not to, but it is your choice. And I concur with that. So
yeah, and I think that it's easy to see. Obviously we've had Australia as its own science project, right? We've talked about that here on the show. But I think when you start to look at how America operates, the idea of trying to squeeze millions of people through the pressure points, one of the things they can do is, let's take wedding reception out of it, but let's just say you have to have a vaccine passport, medical exemption, religious exemption. I'm going to include that because I can't see any reason that won't fly here in America. In order to go into the building to get your marriage license, renew your driver's license, registration, pay, let's say, property taxes, or whatever. I mean, I know there's online options, but what if online options are shrunk or eliminated to force people to use those? And then, of course, federal buildings. So it could be like for court cases, it could be for traffic, paying your traffic fines. It could be for jury duty. It could be, so I can see all of these things coming, folks, that you can see society and the pressure coming in really fast, very, very quickly. And I'm actually shocked that wasn't more of the strategy instead of this business mandate thing. Because I think that just puts them in so much more political animosity than trying just, well, we control all these buildings and all these infrastructures. This is what we'll do.
Yeah, well, they've kind of already done that in a way in some cases with the entry into restaurants. If it's not fully implemented in travel, it will be. You at some point you won't even be able to get on a Greyhound bus without being vaccinated. But I think there will be a breaking point though, and I think it's going to affect essential services. And I think if this happens, a lot of people that support this stuff are going to get lambasted when I mean, I tried to make an appointment today with somebody at TGH, and I got a email back saying, check with us in 4 to 6 weeks. All of our physicians are working at the hospital. We're not taking routine appointments.
Mm,
And imagine
yeah.
that, in so many other fields of work and offering services and stuff. I think it's going to hit a breaking point if it keeps on going like this.
Well, I saw, and again, I'm going to say it's conspiracy theory and conjecture at this point, right? But we saw with like the airlines canceling flights, and we heard weather being blamed, we heard staffing issue, that kind of thing. I did see and read a very extensive Twitter thread. It was like 14 parts. It was secondhand, and it alluded to why this pilot did not want to get vaccinated because he had already had COVID. He believed that his natural immunity was good enough. It wasn't worth taking the inherent risk of being out more during a staffing shortage and all those kinds of things. But so that's all. It's a conspiracy theory if that's why they had their shortages and cancellations. However, it's easy to see that, as you were saying, Bob, that you start to see not only essential services, like pretty irreplaceable elements of our society. Like you start to look at uh, pilots. I know there's even been talk in sports. Like you start looking at elite athletes who are not going to participate, whether they sit out, whether they get banned, maybe they can only play in a certain arena and not another arena. You start to see people kind of shaken quickly into like, is this the hill that I want to die on or not? And I don't know about you. I don't know what percentage of people will kind of come along or who will go along to get along.
Yeah. Well, I saw a story earlier today. I guess Chicago had, I don't know, 13, 14 gunshots last night. It's not even a weekend. And they were talking about, well, what's going to happen when they suspect somewhere around the 25 or 50% of the police force won't be working in a week because of the vaccine mandate in Chicago. Is that taking us to a really, really bad place? Yeah.
Yeah,
And that's just one
definitely.
thing. I mean, what happens if this happens to fire departments?
Right, right. They're just short staffed. They can't keep up. What are
You're,
they going to do? Yeah,
you're
you're
calling
absolutely
911
right.
and nobody's coming. Nobody's
Right.
coming. Yeah.
So another example of this, or another way you're seeing sort of the broach on liberty, would be the bizarre attack already on Christmas and holidays. We saw a massive surge last year, and obviously with the cold weather coming, you're seeing an outbreak right now in Michigan. I will predict, based on the statistics, that you'll see a pretty big outbreak in the Northeast and the Midwest as the winter months come. And Bob, I wanted your thoughts on this bizarre headline. Again, I'm not going to pretend to be an expert, but it said for holiday parties, CDC says using a window fan is advisable. But I wanted to get down. It says the U.S. Centers for Disease Control and Prevention recommendations for the upcoming holiday season include the idea of using a window fan to keep the air in an indoor party as fresh as possible. The CDC appears to be suggesting that circulating air indoors can ward off airborne coronavirus, or at least reduces chances of spreading during home gatherings. What are your thoughts on the use of a fan as a viable way of reducing, transmission?
Well, I guess at least in theory, that's probably helpful. I mean, we know that, uh, air circulation helps. We know that with the winter coming and a lot of people being, stuck in their homes with multiple people while it's too cold to go out, cases might go up again. I mean, we see that during flu season. That's why flu season occurs during the colder months because more people are inside. So I don't think I'm not saying it's not plausible. It's a part of trying to keep yourself safe, I guess. But it's really interesting because that brings me to a tweet that I saw the other day from a PhD professor up at Harvard, and she says it's 6 weeks away or 4 to 6 weeks away, and she tweets that we're planning on having 10 people over for Thanksgiving. Everybody's going to be vaccinated, and we will be doing tests on them when they get to our house to make sure they're negative. And then she goes on to the next tweet. We have pretty good ventilation in our home, so that helps. So so she's going around in that same line. But I was thinking, would you like sit there and do COVID tests on guests at your house?
I'm ready to test you right now. I'm not sure I feel safe, even with our computer distance, that we shouldn't have you tested.
I should put my mask on.
I just can't
imagine.
We should start a show like that with Snicker. We start the show with our masks on and say, well, we need to be transparent with you. But there's not really good circulation in this room, Alex, and we're not sure that we feel safe if we don't have good circulation. He would freak out. He would be like, what the? I'm not sure I could keep his profanity at bay.
No, probably not.
It'd be great, though. I might do it. I
don't think it's off the wall saying that circulation and ventilation is useful.
Especially if like you said, okay, so when we talked offline, it's like, if you have, you're up north, it's snowed outside, so your house has been closed, so you might have indoor heating. So yeah, okay, an indoor fan, a lot of these homes don't have ceiling fans, so a window fan or a room fan might be better than having no circulation whatsoever. So fair enough. If we can take it at that face value, then that's fine.
Yeah,
we're willing to let them go. It reads very, very strangely, though, and it caught my eye, and that's how I thought I would include it in this segment to bring up a window fan. I don't know, whatever.
Hey, we're News Talk with Brandon and Bob. We're here to tell you about some of the facts so you don't have to waste your time watching CNN.
We don't want you wasting any time with CNN.
Or Fox, or MSNBC, or some of these other guys that are making a whole lot of money.
Et cetera, et cetera.
It's not paying.